So thank you very much to the organisers for the opportunity to speak today. Today I'll be presenting data from the Opposites Attract study, which is the Kirby Institute's ongoing study of HIV treatment as prevention in homosexual male serodiscordant couples in Australia, Bangkok and in Rio. Today I'll be just presenting some behavioural kind of data rather than the data of the main analysis around treatment as prevention. So obviously we're all extremely familiar with this slide from HPTN052, and this was updated yesterday, and I don't have those updated numbers here, but we know that treatment as prevention is highly effective in heterosexual serodiscordant couples. And more recently, we have data from the first evidence of the potential effectiveness of treatment as prevention in gay men, coming from two interim analyses. First, from two ongoing cohort studies, I should say. So first was the partner study presented last year at CROI, which showed no transmissions after 2 years in heterosexual or homosexual serodiscordant couples who were having condomless sex with each other and where the HIV positive partner had undetectable viral load. And then this year, earlier this year at CROI, our study, the Opposites Attract study, also showed no linked transmissions among homosexual serodiscordant couples after 150 couple years of follow-up and over 6,000 acts of condomless intercourse within these couples. However, it should be noted that from the results from both of these interim studies were also statistically consistent with some risk of transmission per year. And moving more on to behaviour, in most such studies, and indeed in almost any clinical studies on antiretroviral-based forms of HIV prevention, there's really been little evidence of couples using condoms less often due to the protection believed to be provided by antiretrovirals in the HIV positive partner or by PrEP in the PrEP studies. And typically we see decreases in condomless use in clinical studies over time. However, I think it's important to note the field is rapidly changing and there is increasing evidence on the low risk of transmission in light of treatment and undetectable viral load, and this may be impacting the sexual behaviour in couples, and this is where longitudinal studies can be particularly interesting. Moving on now to our study. So Opposites Attract is an observational, prospective, longitudinal cohort study where the unit of recruitment is a homosexual serodiscordant couple. The primary aim of the study, as I've said, is to determine the degree to which HIV treatments reduce HIV transmission in relation to anal sex. And the study design is similar to, but not identical to, the ongoing partner study in Europe. So the couples are followed up over time by attending clinic visits at least 2 times per year. In Australia, they can attend more than that, but it needs to be at least 2 times. At every clinic visit, the HIV positive partners have their viral load and CD4 count tested. Negative partners are tested for HIV antibodies, and both partners have STI tests. Both partners also complete a questionnaire around the time of each clinic visit. So in Australia, that's actually done in their own homes by an online Kazi, and in the 2 international sites, it's done in the clinic. And this isn't so relevant to today's analysis, but the phylogenetic analysis of any transmissions, seroconversions that happen in the study happen at the interim analysis and also will happen at the end of the study to see if there are any phylogenetically linked transmissions. This is an international multi-site study, and it's being conducted in 14 clinics in Australia, 1 clinic in Brazil and 1 clinic in Thailand. And in this analysis, we were interested to see if condomless intercourse increases when the HIV positive partner is perceived to have undetectable viral load and whether there were differences between the 3 countries participating in this study. So we have presented some of this sort of data on condomless sex before, but this is the first time that we've presented any of the data from Brazil or Thailand. And perceived viral load here is chosen rather than the actual viral load that's measured by pathology testing, because when it comes to decisions about using condoms or not within a couple, it's really the beliefs about the HIV positive partner's viral load that's more likely to influence behaviour than the actual viral load. So that's why we're quite interested in that. So moving on to the results. Up until the end of June this year, we had 269 couples enrolled, with about 85% of these still under follow-up. So the 15% that are not under follow-up, some of those are broken up and some have just left the study for other reasons. And just over half of the couples reside in Australia, 1/4 in Brazil and 1/5 in Thailand. Briefly, in terms of the demographics, the average age of the participants is in the mid-30s, the vast majority sexually identify as gay, around half are university educated and are employed full-time, and there is a large degree of ethnic diversity across the sample. The couples in Brazil and Thailand were on average younger, they're less likely to identify as gay, and less likely to be employed full-time. So the Opposites Attract study is open to any men who regularly have sex with a serodiscordant male partner. So it's broader than what we might consider usually as traditional romantic couples. We don't require couples to have been together for or having sex with each other for any specified period of time prior to enrolment. And indeed, we actively seek newer relationships, given that previous evidence from our group indicates that the first year of serotive coordinate relationships is the most risky time for HIV transmission. And we also they don't need to be romantic committed couples, they can be any kind of sort of relationship, and we ask about what type of relationship they're in. So we can see here that we have about 41% that are in fairly new sexual relationships of less than 12 months, about 1/3 between 1 to 5 years and 1/4 over 5 years. So we're quite pleased to see that quite large proportion there that are in early relationships in that first year. And furthermore, just to give a little more characteristics about these couples, even though we do allow any types of sort of regular relationships in this study, we can see that about 70% report that they live together and 96% describe their study partner as either partner or life partner, husband, boyfriend, fiance, those kinds of words that really do indicate that this is a romantic, committed cohort of couples rather than the type that are not so romantically committed to each other. I think it's quite a big ask to ask a fuck buddy to come into a study with you. It's a bit like asking them to get engaged. In the 3 months prior to baseline, 39% of the HIV-negative partners had sex with men outside the relationship. And in Australia, this was about half of the couples. And this corresponds very well to almost all behavioural research we ever do with gay men in Australia. It's always about half that are monogamous and half that have sex with outside partners. And sex with outside partners was much less common in Brazil and Thailand, although the difference was significant only for Brazil as compared to the Australian couples. Nearly 1/5 of the HIV-negative partners reported having any condomless intercourse with outside partners in the last 3 months. And again, this was high in Australia compared to in Brazil and Thailand. But this also indicates the real need for the phylogenetic analysis to make sure that you're capturing linked and unlinked transmissions. So turning now to HIV treatment and viral load, the majority of HIV-positive partners were taking ART, and although at baseline the proportion was much lower in Bangkok at less than 50%. And Thailand has recently changed its guidelines so that all positive people will now be accessing ART, and we are seeing a sharp uptake in treatment across follow-up. And since various labs participating in the study use assays that have different lower limits of detectability, we use 200 copies. Less than 200 copies is what we're going to be calling undetectable. And so just to show those results here, so as to be expected, it's really similar proportions as those who are on ART who have viral load copies of less than 200. And this was, again, significantly lower in Thailand. So at baseline, 61% of negative partners perceived their HIV-positive partner's viral load to be undetectable, 1/4 perceived it to be detectable, and 14% didn't know the last viral load result. In Australia, detectable viral load tended to be overestimated, whereas the negative partners in Brazil and Thailand were more likely not to know the result, and that was particularly so in Thailand. You can see there 38% who didn't know the result of the last test. So of the HIV-negative partners that knew the result, the vast majority had been told that specifically by their partner, although we again saw significant variation between the 3 countries, as you can see in the pink box there. So it's much higher in Australia and Brazil than it is in Thailand. But actually all 3 of those differences were significant. Smaller proportions of negative partners saw the result itself or were told by a doctor. And this is most likely in cases where the couples are actually visiting the clinic visits together at the same time, which is actually happening quite a lot in the cohort. And it's good to see that only 2% simply assumed the result, or they believed that result based on a past viral load result. So there seems to be a fairly high degree of communication in this cohort about viral load. So in terms of condomless anal intercourse within the couples, at baseline, just over half of the negative partners reported having had any condomless intercourse with their study partner in the previous 3 months. And amongst Australian couples, this goes up to about 2/3, and again, this was significantly lower in Brazil and Thailand. So you can see here that the overall picture is a lower risk cohort of couples in Brazil and Thailand compared to the Australian men. So now we'll move on to our primary analysis for this presentation, which is the association between perceived viral load, which is asked from the negative partner in the surveys, and condomless intercourse. So overall, the data indicated that HIV-negative partners were 2.5 times more likely to report condomless intercourse with their study partner when they perceived the viral load to be undetectable as compared to detectable viral load, and that was quite significant. and those who didn't know the viral load were somewhere in the middle, and that was not significantly different to detectable viral load. However, again, there was major differences between the three countries included in the study. In Australia, this pattern was actually even more striking. So it's nearly 3/4 of couples where the viral load is perceived to be undetectable had condomless sex with each other, compared to less than half where it was detectable or unknown. By contrast, there was no association between these factors in Brazil and Thailand, as you can see from the p-values and confidence intervals there. And you can actually see from the patterns of results in the percentages there that it's really sort of just all over the place. So the ones that are having condomless intercourse with each other in Brazil and Thailand really aren't using perceived viral load or viral load results to make any decisions about what they're doing with each other, it seems. So in attempting to interpret these results, we've had a few discussions with our colleagues from each of the three countries, and we've considered a few of the different important differences, potential differences between the countries. So first, at the level of individual gay men in discordant relationships, or gay men just generally, there may be differences in the countries in understanding and awareness of viral load results, despite the fact that all three of the countries participating in Opposites Attract have had viral load monitoring as a standard part of routine clinical care for many years. So we also think that there may be slightly lower research literacy amongst patients in Brazil and Thailand as compared to Australia. And related to this, there are likely to be differences in the capacities of individuals, or perhaps to determine the best ways to incorporate new research findings about viral load and prevention into their sexual lives. And secondly, we also suspect some differences at the level of clinicians and healthcare workers, in that there appears to be some more limited dialogue in Brazil and Thailand about treatment as prevention, despite various guidelines moving to treatment for all positive patients. And additionally, there may be differences in the level of support for the strategy of undetectable viral load, and consequently varying degrees to which research findings may be shared openly with patients. And thirdly, there's also likely to be a greater level of community awareness about viral load generally in the Australian gay community, and more specifically about treatment as prevention. There's been relatively widespread community dialogue about these topics for several years in Australia, initially spurred by the publication of the Swiss Statement in 2008, but more recently there have been several large-scale community education campaigns which have targeted first HIV-positive gay men to consider early treatment by talking to their doctors, and more recently, campaigns that have targeted all gay men with explicit messages about the reduced risk of transmission when viral load is undetectable. And here are some examples of those campaigns here. So the ones along the top are the ones that have really focused on the positive men and asking them to consider talking to their doctors about early treatment. And the one along the bottom is a campaign that came out this year, specifically in the state of New South Wales, really talking to all gay men. This was a huge campaign on billboards and bus shelters and all over the place, really talking about undetectability and its lower risk of transmission. And to our knowledge, these kinds of campaigns and general community dialogue have not been as present in Brazil or Thailand. So as a potential consequence of this increased community discussion is that in our sample, the Australian couples tended to have more optimistic attitudes towards the effectiveness of treatment as prevention, as measured by just a 5-item scale that we have in the questionnaire, compared to both Brazil and Thailand. So they're both significantly different, and Brazil and Thailand were no different to each other in terms of those attitudes. And the scale is just that the higher the point on the scale, the more optimistic the individual is about treatment as prevention. So considering the impacts of perceived viral load and optimistic beliefs, we found that in Australia both perceived undetectable viral load and optimistic beliefs were independently associated with increased condom intercourse within the couples through multivariate logistic regression. By contrast, in Brazil, neither factor was actually significantly predictive, although optimistic attitudes was marginal. And in Thailand, only optimistic beliefs and not perceived viral load was predictive of increased condomless sex. So in conclusion, we found that among the gay male serodiscordant couples in this study, condomless sex within couples was relatively common and was prevalent in the majority of Australian couples. These proportions are much higher than what we actually find from other Australian studies of serodiscordant couples, where it's usually only about 40% that report condomless intercourse with that partner. HIV-negative partners in Brazil and Thailand, but especially in Thailand, were less likely to know their study partner's last viral load test result, and Thai-negative partners are less likely to have been told that result by their positive partner. And the HIV-negative partner's perception of his positive partner's undetectable viral load was strongly related to the increased practice of condomless intercourse in Australia, and whether or not this is important for HIV transmission in homosexual couples will depend on whether HIV transmission still occurs at very low levels of viral load, which is somewhat still uncertain. And by contrast, we did not find this relationship in Brazil and Thailand. And finally, optimistic beliefs about treatment as prevention were related to increased condomless intercourse. In Brazil and Thailand, while optimism was lower overall, amongst those who were more optimistic, it may be that beliefs about the general concept of treatment as prevention trump the specifics of the partner's viral load test results. So in the future, it'll be really interesting to examine these patterns in the cohort over time. So to finish, I'd just like to thank all the study participants, the study investigators, site investigators and study coordinators, lab staff, and our community partners. Thank you very much.
We have time for a few questions. Just curious, Ben, in light of the findings, is there any thought, although this is an observational study, to do any further interviews with providers about their comfort level talking to their MSM patients about sex, and with the participants about their comfort level in talking to providers about their practices?
No, we haven't. In this study, we haven't done that at all. I think that's a really key point. There is other research that's happening in Australia from a different research centre that's really looking at provider attitudes and that kind of thing. And we have other surveys that will look at Ask Gay Men, sort of how they feel about those kinds of questions, but we didn't actually have that as part of Opposites Attract, no.
Does it work? No? I have the microphone.
If you're talking to, sometimes it'll pick up.
Okay. Here it is. Giulio Maria Corvelli, European AIDS Treatment Group again. It is more a question about the language. Why do you say optimistic belief about the risk of transmission? Am I wrong saying that I cannot pass HIV since I'm undetectable for 15 years now?
Really, the word optimism is just used because there's a long history, I suppose, of these types of scales in treatment-related optimism, HIV health optimism, viral load optimism. So that was really just the word I used for this presentation. But we're not at all wedded to that particular word, no.
Thank you.
We have a few minutes. If there are any other clarifying questions that anybody would like to ask any of the members of the panel.